Now the Deputy Health Officer for the Jackson County Health Department, Matthew Budd. Good morning.
Good morning.
Happy Pie Day.
Yeah, happy Pie Day. I was just, of course, noticing you were just talking about pies, and what a great segue into National Nutrition Month.
Absolutely.
Of course, because, pies, of course, are part of a healthy balance and moderation, perhaps.
Even the sugar pie?
Have you ever had one of those?
I have no idea what a sugar pie is.
They're delicious.
They're like all sugar in crust.
I don't know if that's my thing. I'm a savory pie person, so we might be doing a shepherd's pie or a cottage pie, loading it full of vegetables tonight,
Very
some
nice.
mashed potatoes. Yeah.
Wow.
Nice.
That's more of a healthy style pie.
Yeah, everything in moderation. If you
That's
want your
right.
apple or something, that's fine too.
Shepherd's pie for St. Patrick's Day.
That'd be a great-
They've got a shepherd's pie for GRB, Grand River has it for their menu, St. Patrick's weekend.
So National Nutrition Month, what is that just, we should start to be aware of what we're doing, right? Is this kind of like a month where like, all right, let's reset?
I think that it probably means something different to everybody, but here, especially at WIC, it's really about encouraging healthy food choices. It's a little bit early in the season to really look at, fresh produce and things here in Michigan, but looking at your fruits, your vegetables, your balanced diet and nutrition, and really using March as a good way to make sure we're making healthy choices.
Mm-hmm.
Yeah, and actually, there is fresh produce at the supermarket year-round thanks to airplanes. So you can get pears and peaches and tomatoes all year round.
Fresh or frozen? Fresh, frozen, canned, they're equally nutritious, healthy. If you have a preference, go for it. Sometimes this time of year, I'll buy some frozen fruits or vegetables in particular, but I have some fresh apples, and courtesy of, our global food system.
Yeah, I think you just gotta, really it's about making an effort too.
Yeah,
That's what it comes down to, right?
Yeah, I think it's not just eating one or two things a day, right? So if you're trying to eat 5, 6, 7 different types of food each day, you're gonna just eat more vegetables, more fruits. I think my WIC team will be mad at me if I get this wrong, but I think recommendations are I'm gonna say around 3 fruits per day and around 5 vegetables per day. I feel like it's in that area, but it's eating more fruits and vegetables, and I think that's something. Last I knew, it was almost 80% of Americans don't eat the recommended fruit and vegetables each day.
I'm sure that number's probably low, if you ask me.
Well, we're talking about vitamins, and if we don't need vitamins,
If you just eat the proper foods.
right?
That's absolutely correct. It's a well-balanced diet, and people, vitamins are also called supplements. And the question is, what are we supplementing? And a lot of the time, we're supplementing our poor diets.
Right. Yeah, you see a lot of people, they'll, buy something that has your little can of something that's got all your fruits and vegetables in it, and you think you drink that and you're doing something for you, but you're
It's
you're
not as good. No,
Yeah.
the fresh sources are really where we get our best nutrition from.
Yeah.
So
and
it's-
that stuff is like $30 a bottle too.
Yeah, I don't even look at that stuff.
Yeah,
So, it's World TB Day.
it is.
What
Yeah.
is tuberculosis?
Okay, so tuberculosis, I think it's a really important thing to talk about. It's still, before 2020, the #1 infectious killer worldwide. Tuberculosis kills millions of people globally around the world, leading cause of death in much of the world. But here in the US, we kind of think of it as a solved problem. In the 1920s, 30s, 40s, we had people in iron lungs, so doing the breathing for people, and it's really because of this respiratory pathogen that is completely damaging for our lung. It can infect other places too, but it's commonly spread, of course, by air, by respiration, so by breathing, and it's pretty contagious and very difficult to treat.
So we thought it was solved. How did it come back?
It's been around the world, and again, a part of that global economy for food and nutrition, being able to get our fresh produce from anywhere, it means we can also travel anywhere, and where humans go, we spread diseases and illness, so it's still elsewhere in the world. We do have, a lot of the time, tuberculosis will come from people traveling or people migrating to the United States, but of course we do have a lot of cases here, what we consider to be latent tuberculosis, so people have the bacteria, but they're not sick with it. 1 in 20 to 1 in 10 people with tuberculosis will actually be sick with tuberculosis, and the rest of the people are carriers of tuberculosis, not in total population, but if you have the bacteria. And of course, any given year, somebody could have that bacteria progress to active illness and infection and potentially spread to other people.
There's been quite a few nasty flu strains out there. I've heard from some people being down a couple weeks. Are you seeing numbers up with flu, and how about hospitalizations?
Hospitalizations and flu numbers are up right now. They've been going up the last few weeks. It's not too late to get a flu shot, and I highly encourage one. I know it's March, but sometimes flu season goes through April or May. But hospitalizations are up. Hospitalizations and infections are down for COVID right now, though, too.
good.
But we still have these respiratory illnesses going around.
This is the 4-year anniversary when everything started to shut down.
Yeah, right around this time.
Yeah.
For sure.
It was amazing. But we still got, even with the mild winter, flu and COVID still spreading. We thought with mild weather we wouldn't have as much.
Right.
And we had our first pediatric flu death this past week in the state of Michigan.
We did. And flu rates are down. We've seen decreases in flu vaccination rates. Used to be high 30s, low 40s%, and we're down closer to about 20% of our eligible population getting the flu vaccine per year.
If people would like to find out information about the services or education you offer, what's the best way to do that?
I would just go to Google and type in health department or flu. You can look at, of course, the health department page, CDC, or a trusted hospital site like Johns Hopkins or Mayo Clinic.
Awesome. Always great to see you, Matt. Thanks.
Thank you.
Matthew Budd, RN, Deputy Health Officer with the Jackson County Health Department. We'll be talking about Cinderella coming up next.